This documentary isn't for the faint of heart, as it features a lot of vicious and brutal acts.
Wearing an executioner's mask and a zodiac symbol on his chest. It doesn't reveal anything about his identity.
I've never spoken to anybody about this.
You sabotaged my aunt's society.
Every society deserves to be protected from me and from others like me, that's for sure.
I don't understand why you people think that I should sit here and cry my brains out for somebody who's going to kill me or rape me or beat me to death. Don't you ever wonder why you don't murder?
This is the Zodiac speaking.
I did the right thing.
Let's hope you don't.
We're gonna have to cut this interview, Nick.
This is so stressful. With the neurologist, Dr. Jim Fallon. Good morning.
Good morning.
Dr. Jim Fallon believes that there are three factors that create serial killers. Can you please state them?
Yes, of course. The three factors are brain dysfunction, mental illness, and childhood trauma. Number one, brain dysfunction. Brain dysfunction, everyone has looked at had damage in their orbital cortex, which is right above the eyes, which is a common factor between serial killers. Number two is the mental illness. Having a diagnosis for certain mental disorders, including the bipolar disorder or antisocial personality disorder, increases the risk of violence. And number three, the childhood trauma. In order to express the NAO gene, which is the violent gene, in order to express this gene, you have to be involved in a certain something traumatic in your early childhood.
Lighting it on fire with cigarette lighters.
Being killed like it.
You also talk about the hallmarks of abuse, cruelty to animals, fire setting, bedwetting. Do people use these things as predictors?
Yes, they do. For example, with cruelty to animals, things like setting a cat on fire. The child is trying to enact what has happened on him on something weaker than him.
Most of these people born with this neurological damage, or did their environment contribute to it?
In some cases, if there's history of drinking and drug use during pregnancy, the child could be born with it. In some other cases, the damage could happen shortly after birth due to head injuries.
Can serial killers be rehabilitated?
I don't think so. They might have a lower potential for violence, but never a zero potential. So this treatment should be done in a correctional facility.
They stop killing once they've started.
We tend to think that they would go on a rampage and that they never stop killing, but that's simply not true. They're human beings. Anything can interrupt their killing.
An American serial killer, sexual predator, who terrorized the United States during the 1970s, convicted of raping and killing over 30 young women, decapitating them and saving their skulls as trophies.
His aunt said that he would come up with kitchen knives and he'd put the knives around his grandmother's bed. That's an abnormal behavior for a child. I had enough data to make a diagnosis of bipolar disorder. He had episodes of highs where he could keep talking in confidence, but these were interrupted with periods of terrible depression. So after he got executed, his wife showed me a packet of love letters from him signed by different names, but the most important ones was signed Sam, his grandfather's name. People who are multiples or have the ID, it's common for them to have an alter who is the abuser.
I'm not asking for mercy, for I find it somewhat absurd to ask for mercy for something I did not do.
Is it possible that he was psychopathic?
I think he was a factor one psychopath because he has a characteristics such as superficial charm, lack of empathy, and also he was a manipulator.
About narcissism?
Yes, I think he had narcissism because many people reported that he has this arrogant way about him, and also narcissism tends to correlate with psychopathy. But another personality disorder that I think Ted Bundy has is bipolar disorder, because 80% of people with bipolar disorder tend to have command hallucinations, a lot of energy, euphoria, and depression. And a lot of these symptoms appeared in many different reports about Ted Bundy. But those claims were argued against because he was never hospitalized in a psychiatric hospital or anything like that.
Recognizable mugshot and cracked smile have become the gold standard of female evil over the world.
She felt in control. She had no experience with remorse, guilt, or empathy. She was combative, incorrigible, and unpredictable. It appears there was a genetic component work related to her father Leodale and his history. She had attachment issues because she had no one to trust, and she also had repeated traumas which she endured for years. She also had a diagnosis of borderline disorder and antisocial personality disorder.
Good, because I didn't do anything as wrong as they said. I did the right thing.
She didn't know her rights from wrongs. She tried to evade the police, but she realized that what she was doing was not acceptable to society.
The attachment theory.
Attachment theory suggests that the care and attachment we experience as in childhood affects our adult relationships. But because Eileen losing everyone in her childhood and that's close to her, it created her detachment personality.
Because of it. Couldn't even get a fair trial. Couldn't even get a fair investigation or nothing.
Do you think Wuornos was competent to stand trial?
In my opinion, she wasn't, but she refused to consider an insanity defense. Eileen probably did not have a true understanding of the charges against her. So, based on her experience, she also had no faith in the system and lacked the patience required with the attorney.
This is the Zodiac speaking. I'm the murderer of the taxi driver over by Washington Street and Maple Street last night. To prove this, here's a blood-stained piece of his shirt.
From all your investigations, what can you tell us about the Zodiac?
Not a great deal. He deliberately misspelled words to let us to believe that he was illiterate, but in doing so, he led us to believe the total opposite of that.
All serial killers have a specific MO.
For some reason, they don't like their way of killing, so they change and modify. Killers are human beings. They make mistakes, they adapt to the tools they have, and they tend to change according to the circumstances.
Do you think that Zodiac killer was mentally stable?
I think that Zodiac killer had a disorder which is the multiple personality disorder, or scientifically named dissociative identity disorder. In his earliest letters, he had given himself the name the Zodiac, and in this case of this disorder, the different personalities give themselves different names. So we may have a violent personality that produces itself to the world as the Zodiac.
He was a narcissist. He emphasized that he was calm. He wanted to be seen here as confident and dominant.
Zodiac 12, SFPD 0. The map coupled with this code will tell you where the bomb is set. You have until next fall to dig it up.
As mocking the police seemed to give him pleasure. Bringing them down made him feel superior. He is cold, calculating, unemotional, and have no empathy. He is criminal mastermind after all.